Good morning. Thank you so much for the opportunity to be here today on behalf of myself and as well my co-presenter, Laura Phillips. I'm from Patients Like Me, and I'm delighted to be able to give you a little more information about what we do, why we do it, and how we do it. And Laura's going to tell you a little bit about her participation on the site as well. I'm going to start by saying first that as we heard yesterday, and I think as we'll hear more today, everything starts with a story in healthcare. And the story is really so personal and important for us to appreciate and understand. So I want to give you just a little bit of information about the story behind Patients Like Me. It began as a result of the experience of the Haywood family. And who you see here is Stephen Haywood. He was diagnosed at the age of 29 with ALS, a devastating disease, and clearly his family was overwhelmed with what they would need to do to try to change his outcome. What they found before long was that there really wasn't going to be a lot of change in outcome, but what they did learn along the way was that there was a lot of people that they were meeting, not clinicians and not researchers, but other patients and families who taught them more than they could ever learn from anything else that they would be able to find in the literature. So the story behind Stephen's experience and his family's experience is what's motivated Patients Like Me to become what it is today, and that is an opportunity for patients and families to be able to connect with each other about what these experiences are like. But I want to be sure that we leave you with this one statement here. Behind every bit of data that we collect and all the data we talk about today is a patient's story, and getting at that story is really what we're all about. So what we try to do is harness the power of patient stories to give it some framework, to give it some substance. So what you see here is our homepage, and I just wanted to give you a sense of a little bit about what patients can do. This is our public homepage. You could go to this page and you can click on a number of different links here to learn, to connect with patients. About a third of our patients, we have 180,000 of them today, over that at this point, but about a third of them have their profiles public. So you could click in there, connect to start to find patients who might be like you or a family member with a condition that they share, and you'd be able to find people who have publicly put their profiles out there for you to be able to look at and review. But the other piece of this that I think is important is to keep in mind that we have about 1,800 conditions represented. So while we started out with some very serious neurological conditions, ALS being included, and you'll hear more from Laura about MS, we actually have expanded that platform quite dramatically over the last year and a half, and it's really starting to represent some very unusual and rare conditions for which there are very few people who ever find each other around the globe who are now connecting with each other. I think this has come up a lot, and I want to reinforce this. This is really, really important. These are our core values. One of the things that we decided early on, and these have stood the test of time from the very beginning 7 years ago, it's patients first. That if we don't put patients first, we will not be able to engender their trust. We have to have their trust in order for us to be able to get the data that we need in order to be able to inform them about anything new. We have to have openness on the platform. Patients come into the system knowing that the data they're going to be sharing within the system is going to be viewable by other patients. If they decide to make their profile public, which is something they have to opt in to do, so they have to give permission to do that, it will also be shared on the internet. But we speak about transparency a lot. We try very hard to be sure that we are transparent with our patients about what we're using the data for when we actually do aggregate it and share that for use. And we want to create wow. And I think one thing I want to be sure that people do know here, our site is free to patients. We accept no advertising on the site at all, so there's no cluttering of the view for the patient with any other kinds of information other than patient-reported data. And our business model is that we aggregate the data. We de-identify it, aggregate it, make it available to people, researchers, academics, pharmaceutical companies who are looking for some patient insight, and make that available to them at a cost. So that's our business model, and it seems to have started to take some understanding within the system to realize that this is a way of being able to get data that's important about patients' experiences without necessarily having other burdens on the patient as far as charges are concerned. So we take their stories, we transform their stories into data, and this process is sort of outlines that they come in, they create a profile, they find support from some other patients, they might find some other people that they want to connect with. They can learn from our aggregated reports, they can download a doctor visit sheet when they go to see their physicians or the clinicians, and ultimately they can play an integral role in their own health care. And I want to bring attention to this, and then I'm going to be introducing Laura's section here. This is a fundamental question that we sought to address as we created the site. One thing that we believe in firmly is that if patients give us something, we need to give them something back. And I heard a little of that earlier this morning, I think, with Peter's project, that you really need to be sure that you're always giving something back for the time patients will take to give the data that they've given. But what we want to be able to do is help people answer this question. Given my status, what's the best outcome I can hope to achieve, and how am I going to get there? And we put hope in there purposely. It's not a given that we are going to be able to help people achieve cure for all of the conditions that we might have within the system, nor will we in our research or in our clinical trials. But we want to give them hope. So that's a key component. So I'm going to actually turn this over to Laura and let her introduce herself.
I'm Laura Phillips, and I've been a member of Patients Like Me since 2008. Getting feedback, sorry. I want you to know how Patients Like Me has changed my life. It really saved me, because when you go to the doctors and you get diagnosed, they give you information, they send you home. What do? You have nobody to talk to. They can't tell you who to go talk to because they can't give you the names of any other patients. Going to Patients Like Me, you get to talk to hundreds of other patients with your same condition and your same concerns. So, you know, you get out of the fishbowl and you can look out and talk to other people, get ideas, and learn about the treatments and what treatment is best, why this treatment worked for them, why this person liked that. It's really, you can't describe it well enough, but you put your profile out, other people can go and look at it. 12,000 people have looked at mine to see if I had anything in common with them that they could contact me on. Keep, your own records. You're responsible for your own records. And it's important to keep track of your own records. So you can look back and say, okay, I was on this drug and I stopped it at some point and I don't remember when it was. I can go back and look. It's really important for patients to keep really good physical records of their own care, and they really need to keep hard copies of any tests that their doctor does for them, blood tests, MRIs, anything. They need to request a copy of that and keep it for themselves. And most patients don't think they're entitled to that, but they really need to do it. It's very, very important to them. When they go back and look later and see how things progress, they'll know what they've done and how they got to where they're going and what they can maybe change at this point to do something different. They can keep track of their MSRS scores. That lets them know how they've progressed, have they improved, because the scores can go up, but they can also go down depending on the treatment that you're on. So it's important to know. You answer 7 questions and that gives you your score. And makes it very easy for you to look at your own thing. I'm probably forgetting a ton of things that I wanted to say.
The MSRS score
Notes are good, but you kind of have to keep up.
I was just going to say that the MSRS score is a multiple sclerosis rating scale, and it's something that we actually have validated against other tools to be able to be sure that the kinds of questions we're asking actually are representing quite well and correlating to the symptoms MS patients experience. Mm-hmm. Go ahead.
As I say, I've been on 3 different drugs. The first one did good for a good many years. The second one I didn't want to be on, but I had to do something because the first one wasn't working, and the third one that I'm on now was off the market temporarily, and that's Tisabri, which is really, I think, the best treatment out there for many MS patients. And if you catch it early enough, I wish I had started it 10 years earlier than I did, but I couldn't. But it is, for me, it's the best treatment out there. And I learned a lot about the drug from other patients on the drug, starting from the trial all the way through. I mean, we have people that were on the trials to get the drug to market. So for me, it's been important for me to find and listen to other people on how they've done with the drugs and and whatnot. You need to be able to share our data with other people and research. Researchers can't do anything if they don't know what's working and what's not. They need the information. So most of the patients give the information because I might not be able to help me, but I might be able to help my daughter should she come down with it. We don't know if it's hereditary or not. But somebody out there is going to come down with it, and they need to know what will and won't work. I think that's the directions. I think that's it. I think I'll turn it back over to you.
You feel like you covered it?
I think so.
Okay. Thank you, Laura. I want to say a couple of things that Laura talked to me about yesterday. One was the issue of data sharing. We've talked about some of that today, and that for her, data sharing is just so important that she can't really imagine not sharing her data, that the value of that for her personally is in being able to help other people who have her condition and to be able to then try to improve that situation for them. But there was another quote that she mentioned yesterday that I do have to share, and she didn't in this one, and that is that when she goes to her doctor now, and she's actually worked with her doctor quite closely, the doctor says to her, "What lesson do you have for me today?" So I thought that was a perfect opportunity for us to understand that the physician and clinicians, we have to say to our patients, what can you teach me today that I can actually then use with you and then use with my other patients as well. So I want to move right into the next part of this, which is partnering with our patients for research that matters to them. I have some results here. Some of these are in your packet, so some of them I'm not going to go into too much detail on because of time. But I want to bring your attention to this. This was a user survey we did across the site, and I just pulled out one of the factors was medication adherence, which is a big economic issue. What we demonstrated was that across the board, almost all of our conditions, and at the time we had a limited number of conditions, patients were reporting that being on the site actually helped them improve their adherence to their treatment regimens. It was particularly significant in HIV, where drug holiday conversations were quite pervasive on the forum. And what a lot of the patients actually did was they took snapshots of their charts, put them into the forum conversations to show what happened to their viral loads and other symptomology when they took a drug holiday, and said, man, just don't do it, it's not worth it. So it's incredibly important to have that kind of data sharing happening among patients. This is our epilepsy user experience, and again, this is in the packet. It has a lot of information in it, but it was very clear that we had patients who were really learning a lot about things that they didn't know about prior. But the one thing that really struck me in this particular survey was that 1/3 of our epilepsy patients had never spoken with another patient with epilepsy. It's an isolating disease as it is. Imagine that you've never actually had someone else that you could share your experiences with. The other work that we do is, this was a research project that we did on off-label use. We have a huge amount of data in our system, and patients and their clinicians are working with drugs that with drugs that haven't been approved for the purpose they're using it for. We believe quite strongly that our data is actually quite useful for us to be able to better understand the prescribing practices on off-label use. And I think the good example is ALS patients are using amitriptyline, which was approved in the 60s for depression and has never been approved for anything else, although we know we use it for lots of different things. They use it for the primary side effect of dry mouth because it dries their secretions, and quite effectively, actually. The one study I want to bring your attention to that really brought, I think, a lot of attention to the power of a social media environment was our lithium study that was done in ALS. The original study looked at 16 patients in Italy with 29 controls. It showed that there was some indication that lithium was slowing the progression of ALS. So that type of news is quite important for people with ALS. What we were able to show in a relatively short period of time by using historical controls, using a matching algorithm that we created because of all the data that we had, which was functional rating scores, similar endpoints that are used in clinical trials, was that there was actually no indication that lithium was going to decrease the progression. We did that in about 6 months. We had that data. We had 10 times the amount of people that were in the study originally, and we actually, in the end, 3 additional studies were funded after our findings at the cost of $30 million, all ended in futility. So I think it's just an opportunity to think about a new novel data source. You can also see that whole article written up in Nature Biotech, and then the Wall Street Journal did a little study on that. I want to introduce you to an exciting new development that's just come out. We've recently been funded by the Robert Wood Johnson Foundation to start an open science initiative, which is going to be doing a partnership with patients and researchers, where we will begin to develop PROs, patient-reported outcome measures, that are actually iterated and worked on within the system. So we can have researchers who are coming up with questions, put it out into the field, test it with patients, come back and say, oh, this didn't go so well, we're going to try a different approach. But we'll begin to gain a lot of knowledge about what it's going to take to come up with the right sets of PROs in order to measure patient experiences. We don't have a lot of those that are relevant today. Some of them are quite old. This will all be done in a Creative Commons as well, so all of this information will be open, and we're quite excited about the opportunity and grateful to Robert Wood Johnson for the funding on that. And I'm going to close with something I think we've heard a lot about. One of the things that's resonated a lot over the last day and a half is that we have to listen. And this haiku I wrote in response to a, I don't know where that went. Oh dear, that's too bad. Well, I'll say it to you because I know it. To learn, listen well. To the impressions voiced by patients first. It encompasses everything we are about, and I think it's everything that we've been talking about. So we need to learn to listen well, and I think we are up to the task. Thank you very much, and thank you, Laura, so much for your participation.